So it's been a little over a year since the folded man had his series of spine operations, and in this video we're going to give an update to that. What's up everyone? My name is Dr. Webb. I'm an orthopedic spine surgeon here in San Antonio, Texas. Today we're going to be talking about the folded man. If you guys didn't see my first reaction to that, I strongly suggest that you check that out. I'll put that right up here. But in short, it's about a gentleman in his mid-40s out in China who has a very serious case of what's called ankylosing spondylitis, which causes basically your bones to be very fused together, but at the same time be very brittle. This gentleman underwent a series of spine operations which allowed him to stand up straight. So we're going to check in and see how his recovery is going. Let's check it out. As you can see, he's ambulating pretty slow, and he's ambulating with a walker. This is something that's very commonly used after spine surgery. A lot of my patients are older, and a lot of my patients do require some form of gait assistance, whether this is a cane or some type of walker. Most patients need these assistive devices after surgery.
And
a lot of people commented on my last video and kind of mentioned that I didn't give a lot of credit to the mom. The mom actually is the hero. She has really looked after her son as a mother should, and she should be receiving more praise than she did, but I should have kind of credit and acknowledged the mother for her role and his recovery and getting him to and find surgeons who can take this complex spinal conditions. There are some surgeons that would not take on something this complex. Ankylosing spondylitis is an inflammatory arthritis that causes your bones to fuse together. This is obviously a very severe case of this. I've seen lots of cases of this in kind of my training and my career thus far. I have a really good friend who has ankylosing spondylitis, and he actually got a hip replacement kind of at an early age. It is like early 30. So it affects your joints, your hips, your major joints. It causes your spine to become fused together. You can have what's called bamboo spine, and really little small fractures can indicate some instability of the spine. Sometimes we have to do these very long fusion operations for these patients. It can affect your eyes, it can affect your SI joint, your sacroiliac joint. So it can affect a lot of different parts of your body. Unfortunately, his case is on the severe side, very severe side.
妈妈是一个慈祥伟大的母亲了。生我不能自理啊，就是洗脸刷牙，那个水啊，都是母亲提到床间放大。
You can see he's sitting up more straighter. He looks like he's a little bit more happier, has a little bit more life. As you can imagine, it's very difficult, or would be very difficult, to just live your life when your body is kind of folded like that. But you know, looks like he's standing up fairly straight, or sitting up fairly straight, and you know, looks more happy at this point after his extensive operations.
用石膏和进去，再用刷牙，慢慢的，再用脸泡，慢慢的塞到那个额头上，就是擦，慢慢的擦一下。
长出来了，长出来了，长出来夹菜。做10多岁、18岁呀，就是带他到这个医院看，那个医院看，就是我一个人背他去的嘞。现在我也没有其他的原因，我一点都不愿意他。他因为我是个生的儿子，因为他这个病没得办法了哦，不是我儿子一个人呢，实际上还有这么多，我就这么考虑了。我是没得办法的，我是再苦啊再难，我是生的儿子的，我一点都不愿意。我以后死了拿过来给他倒屎倒尿啊哦，我就考虑这一点，我就为了我儿子没有治好的，我儿子以后那个暂时我就可以显示他的了哦，儿子以后就没有去打的。我在这里我还帮我儿子一段时间，我说我走了，我给儿子拿过来打的打，我就这个没事，我儿子可怜，我就没事。
Wow, she really should win Mother of the Year award. Man, she's about to make me teary-eyed over here.
我儿子，我每天主要给他倒屎倒尿哦，6天的每天一天主要早上起来晚上就要给他倒，主要倒完过两天都给他。同时来的他就时时没事哭，没事出眼泪，没事治的病这么严重，红人治不好，别人都治得好，我这么又不能治好。他就说是有时候有点是悲，有时候心里呢不好过。我有时候总安慰他，你是指能够看手指，现在能够经常好好看手指，你看到哪道手指哪个医院能够给你医治好，我就陪你去，我就到医院上去。
And this is something that is not commonly talked about a lot. Patients who have very severe medical conditions, whether that's hip arthritis, you know, spine problems, spine issues, pathologies, you know, these patients can have very severe depression, and this depression can lead to pain. The pain can lead to depression. So it's like a cycle that just keeps going on. A lot of times we tend to overlook and neglect the patient's kind of mental or their social economic status, and that's something that, you know, even I need to do a better job at, which is just taking a look at the overall picture without just focusing on one particular problem that the patient is presenting with.
对，这都很重要，好吧？这些锻炼，包括胳膊也用劲儿。
这个病人还有是最严重的，也是最复杂的。手术一旦出现了风险的话，有可能会。
This little device that he is blowing in with the 3 balls there, this is called an incentive spirometer. We use this commonly after surgery to keep the patient's lungs open. So basically there's a couple different types. They either blow in it to actually increase the volume of air that's in their lungs so that their lungs don't stay deflated. and increase the risk of infection, such as pneumonia. Or they can either breathe into this device, inhale very deeply, and that will open up their lungs. And we can usually tell the respiratory or some sort of glance at their respiratory status based off of this incentive spirometer. If they are able to pull in 2,000, 1,800, 2,000, 2,500 mLs of air, that tells me that their lungs are fairly okay. If they're able to hold these balls up and inhale and hold those balls at the top, well, they have a lot of reserve in their lungs. They have the tidal volume or capacity, vital capacity, that sometimes we have to measure this via other parameters such as ABG or some blood work, but this gives a quick glance of how this patient's doing. I can tell that his lungs before surgery were pretty poor based off of this incentive spirometer that he's blowing on now.
是云休克啊、结肠啊，甚至病人认为就会危及到生命的，那这块你也要有一定的心理准备。
害怕我不怕，我都没事。我陶主任，我相信你，你只是搞30多年工人了，你慢慢来了，慢慢做了。你，医生听你医生的指责，你一心一意跟我的话之后，我也放心。你头一这块底下哪个敢做啊？是吧？不到前头他那个梁医生都不敢做，陶主任给他做了的，我是感到是很高兴。
明天的手术，我们计划进行一个双侧的颅颈结构。
我也不怕了，如果不做这个手术，自己也活不了多久了。就说试一试，做的话还可以一点点希望了。
筋膜已经打开了吗？
The series of operations that they had to do to realign his spine are essentially, just in a big, easy way to kind of understand it, is essentially to break his bones, called an osteotomy, to try to realign his spine. As you can imagine, his spine is kind of bent over. In order to reverse that bend, you have to break the bones and then compress them down and hold them there with rods and screws and hopefully fuse his spine. And that's what they did over a series of operations.
现在可以看见人，可以，我觉得这个住院是慢慢的开始可以走了。
That's awesome that he's able to work again and kind of contribute back to society and provide for him and his family. You know, that's one of the reasons why, as a surgeon, you know, I do some of the surgeries that I do. Patients come in very severe pain, or if they have arthritis of their hip or their shoulder or their knee and they can't walk or have pain with ambulation, then we're able to do these operations where they can get back to doing some of the things that they enjoy doing and able to get back to work without much pain. So that's incredible that he's able to work again, especially after, you know, his condition where he was, you know, so kyphotic, and that just means bent over. That's incredible. Now he's able to brush his teeth, perform some hygiene, do some things around the house. And before that, he was barely able to do those things. So that is really impressive.
没想到自己还能够站起来，头抬起来看着，能够看见电视，能够直起腰来，能够坐到凳坐起来，能够平常觉睡觉啊，这是真的不敢想象。这是什么目标？就是在家里做些力所能及的啦，做些小生意啦，就是减轻父母的一些负担嘛。
对他也希望希望，现在他好了，期待他慢慢的能够对他要视力要锻炼。现在我是他没有是他的想法了，他现在一切都正常了，可以刷牙呀，可以洗脸呀，可以上厕所啊。我以后走了就放心一点了。
妈妈每次听到儿子吹这首歌有什么感觉？
心里感动啊，感到流泪。
Wow, that's an incredible story, and I'm glad he is doing well at this point. It looks like he's about a year and a half from his operation, but these are some very serious and complicated surgeries. As you kind of heard that the mom kind of mentioned that some surgeons weren't even willing to do these operations. It takes a whole team of professionals, from anesthesiologists to the critical care doctors to the spine surgeons to the neurosurgeons to the neurologists, to kind of come together to come up with a plan to help this gentleman. And it's very refreshing to hear that he had a good recovery thus far. When you're fusing the patient's spine, the things that you have to be concerned about is that the levels above the fusion and the levels below it will break down quicker because of the increased stress. Patients can get what's called PJK or PJF, proximal junctional failure or proximal junctional kyphosis. These are just fancy words that means there's too much stress at those fusion levels that the level above it will actually start to tip over. And you saw that he was still kind of bent over somewhat, but overall, clinically, he looks like they got a really good correction and he's able to ambulate. So down the line, the things that the surgeons need to look out for is this PJK or PJF. If that happens, sometimes we have to go back in to take him back for another surgery to try to increase his levels of instrumentation, fuse him at additional levels, and the problem is that those levels above that will degenerate and they can break down. So anytime there's a long fusion in the patient's spine, you have this risk, and there's papers that look at the risk factors for that, but overall, he had a good result. I would call this a very good result. He's able to work again, do things kind of around the house, perform some hygiene, you know, thinking about starting his own business. That's an incredible success story. And it looks like he's not in a lot of pain at this point. So I just wanted to give you guys some updates on how he's doing. And I was curious myself in terms of his recovery. Was his surgery successful? And I just wanted to share that with you guys. But everyone else, thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.